Cloud. Okay. I wonder if I was going to say it. All right. Hello, everyone. Welcome back to the speaker series. I'm so excited to have Neelam here with us today. She comes from a little bit of a different background. She is a nurse and an assistant professor at the University of Alberta in Canada. So I'm excited to learn more about what sexuality and what that looks like in Canada and kind of in a different discipline than we normally have on the show. She is really here to kind of talk about advocating for young people's rights. And since we are in Sexual Health Awareness Month, we're going to talk a little bit about how she does that in her work and what she thinks there needs to be more of in the U.S. So Neelam, if you would just introduce yourself, tell us anything you'd like the listeners to know, and we'll start from there.
Thank you, Megan. I'm really excited to be here and chatting with you. So I am Neelam Punjani, as Megan mentioned. I am a registered nurse. My home country is Pakistan, and I have been in Canada for the last 6 years. I came to Canada for my PhD. I completed my postdoc. And then I recently started my position as assistant professor at the Faculty of Nursing, University of Alberta. I'm very passionate about children and adolescents' sexual and reproductive health. And I think that's, I will tell you more about it as we go forward and what I do in my work and what I have been doing before and why I'm passionate about it. Yeah.
Perfect. Yes. So, and kind of going along the lines of that, tell me why do you care about adolescent sexual health? Like, what got you to that? What keeps you there? Why is that important to you?
So I started my journey, when I entered into the nursing program. Honestly, I had no idea that this is so important topic that I'll be interested in, and that was back in 2006. So, as you are starting your graduate school, you are also excited. So it was just about going into the profession where you are serving people, and it's a healthcare professional. So healthcare profession is like really good for. So back home, for girls, there are like some professions that were, and that's it's not there anymore because time has changed and girls are going everywhere. But just was just kind of a thinking like going into the healthcare profession is good. So I just went into the nursing program. And the first year is like mostly theory courses, and then as you go forward into the clinical courses, like you'll start to learn more things. You get to have like exposure with so many things when you go to the clinical settings. So my first encounter, I would say, my first trigger was when you go to the clinical setting. So then you have a initial assessment form for your patients that you have to fill out. So that's just mostly history taking, and I think that's the first part that you learn when you go to the clinical, either it be a community clinical or the hospital setting clinical. So you go and you talk to the patient, you ask all kind of a history questions. Okay, so you see their orientation by asking some questions, checking their nervous system, you are checking their cardiac system, their respiratory system. And in the initial assessment form, there was a section on the sexual health that was always cut off. I mean, it was there were questions, but we were not allowed to ask, or I would say we were never encouraged to ask those questions. So I never asked that, and I have never seen patients, or I would say people in the community, asking those questions, except for when you are going to a very rural community and you are talking to women, they might ask a couple of questions about menstruation and stuff. But other than that was the main portion that was always cut out of everything. And then I think that was my first trigger point, thinking when I was growing up, I never had any information about sexuality. Even when I started my first period, I didn't know what. I'm am I dying? What is it? I was so scared of everything. So I think that was when my interest started to think about why people are not talking about it when it's just like a general health issue. And then in my all 4 years there was no as such, there were no course as such that talks about sexuality. But I remember having that one guest lecturer where, and I think she's my mentor too. Her name is Naushin Salim. So she came, and then she was all passionate about SRHR and talking about sexual health and why it is important and all those things. So I think that is when I started that I just started my interest and I learned more about it. And again, as I entered into my graduate studies, I never knew that I do master's program and PhD and all those things. But I think after I finished and started my clinical practice as registered nurse, I think that's when I realized, like, although I love clinical setting, working with patients in hospital setting, but I think there was something that was missing because I really wanted to do something in sexual health. So I think that was my next step to take my passion up to the next step where I decided to do my master's program. So then, I can just kind of explore my interest more. Yeah.
Yeah, I think you have a really similar experience to a lot of us in that we don't really understand that there is a whole field of sexuality that you can study and research and kind of help shape. And similar, I did have a sexual health class in undergrad, but before then I really didn't have, I had a little bit in high school, but other than that, I didn't have a lot of kind of formal sexual health information. And it sounds like for you, if you hadn't had your mentor kind of come in and talk to you that one day,
Mhm.
you may be still bedside or doing some other sort of
Yeah,
area.
that's totally right. Yeah, yeah.
When you think about kind of sexual health awareness in general, like what do you think are some kind of normal ways or ways that you advocate for kind of awareness of sexual health in general? And what do you think are some other ways that folks could get involved?
Mhm. So when we say sexual health, so sexual health somehow itself is such a big taboo that
Yeah.
we are just kind of not thinking about it as a normal process, right?
Mhm.
And when we talk about sexual health, so people think like, when if you're generally talking with somebody else, like who is not in this profession, they would think like, this is something that would start from puberty. And I think
Mhm.
that's a lot of, that's the thinking of, general public, I would say a lot of parents, teachers, healthcare professionals are, because, again, healthcare professionals do not, or maybe now they have, like, back then, there was not much awareness. So sexuality is always something that is considered as, once you start to hit your puberty, then, you will have like, all those sexual things coming up.
Yeah.
However, one thing that needs to be understood by general public is that sexuality is a very normative process that starts very early on, as soon as the child is born. They start exploring their body parts when they're 6 months or 8 months. You start talking about, like, what is the good touch, bad touch, just small things. So it starts very early when you start talking about small things. And I think the other challenge that is faced by public, and this is something that I am speaking from my research that I have done in my postdoc. Um, Parents are, nowadays parents are willing to talk about sexual health with their children. However, they just don't have that language. Like, they don't know, like, how to start and when to start. So the age appropriateness of the sexual health knowledge. So that this is where, because, as we grow up and, we have more exposure, somehow the sexuality is something that becomes like something topic like that, which is hush hush topic, whereas we just kind of forget, like, that's just a normal part of your life, that it's there since you are born and it will be there, once you die. So I think this is something that is like, missing part of sexual health. Yeah.
No, I agree 100%. I think there's a lot of stigma when we say the word sexuality, and it kind of goes to like porn and other kind of really dramatic, like,
Yeah.
like polarizing topics that we really don't discuss a lot in sexuality. And you're right, it starts at childhood when they're born, right? They were made hopefully through parents loving each other. And so now we're talking about like, the sucking reflex and all of these things that are so natural. But I think you bring up a really good point that I think it's maybe not that parents don't want to talk to their kids, it's that they don't know how, and they're not sure when, and they want to say the right thing, and they don't want to promote sexuality and all these things. So we'll maybe get into it a little bit later, but thinking about how we can kind of normalize these conversations around sexuality and what it looks like. And I think that's a really great place for people to start, is just in their kind of everyday conversations, right? Myth busting and just kind of talking about what's happening and not making it so stigmatized and taboo.
Mhm.
So You mentioned a little bit that you grew up in Pakistan. So I would love to know a little bit about kind of what does sexuality look like there? Is it talked about? What education did you get? Did you get information on these topics? And what do you think are some current issues in sexuality if you're still kind of involved in sexuality in that space?
Mhm. So sexuality in Pakistan is something that is, I would say, not talked about with children when they are, even at their homes, and when they are going to schools, they are growing up. So from my experience, when I was growing up, I would say in school settings, when you are in your, final primary years or going to the secondary classes, like around sixth or seventh grade, then, these pad companies like sanitary napkins companies, they come and they give sessions, but it's only for girls. They are never for boys. And they're just selling their products. They would say they would explain few things like, that the female body will start bleeding at this stage and, what's normal, what's not. But, it's just kind of giving information in order to sell their products. But and that
Mm.
I don't believe that they ever give you chance or opportunity to ask questions if you have, because I don't think so. Those people are like professional or the sex educators to answer your questions, though. But it's just like, and then in the brown bag you get your sanitary napkin, and then you go, and then there is nothing for boys. So that
Mm.
of course, that they definitely would start developing that curiosity, like what's going on, what are they talking
Sure.
about, are they hiding, why only girls are going. Um, and then in schools, like, except for the science subject, and even like, I don't know if that would come to you as shock, but, sometimes in a lot of schools, and I think that's being debated, like, a lot, like, when you are starting your new school year, you'll be asked to staple all those like sexually productive science book pages or just
Yeah.
glue it. So I mean, what are you doing with kids? Like, are you telling them this is something that we don't want you to see? And then
Yeah.
are they not very smart to not see those things? So
Right.
this is something that was happening. And then again, the girls will start getting some information as they are growing up. If they have elder sisters, they would talk about menstruation and all of these things.
Mhm.
Um, so this is when I was growing up, and then when I started like advocating for sexually productive health, I just got some opportunities to connect with some organizations like non-governmental organizations where
Mhm.
they have started to go into the schools, like, to the primary classes and secondary classes, and they would start talking about, good touch, bad touch, what are your private parts. So that was really good progress. However, you cannot say that you are giving sexuality education to the children. So
Mm.
that comes under the umbrella of life skill-based education.
Mhm.
So then they can prevent themselves from child sexual abuse and all those stuff. But
Mhm.
I think there is a lot of progress that has been happening.
Mhm.
Again, another thing that is, um, I would say, because in Pakistan, a lot of like 97% of the population is like Muslim. So being in
Mhm.
the Muslim culture, sometimes they are like, it's not appropriate to talk about. Again, it's just what you are thinking, what your religion is teaching you, but sometimes it's not true. So people would think like, I mean, you would learn eventually, and then as you get married, you would learn what are the other things, how to give birth and all those things. But there is no formal education, and then again, there are very rural areas where I think the culture is something like it's not in Pakistan. There, growing up, I have seen a lot of patriarchal culture, and it's not really like in remote areas, but in urban settings as well. So then,
Mhm.
women or girls are kind of like they never get opportunity to talk about such things. So like because it's a cultural taboo as well.
Sure.
Um, Again, when we talk a lot about girls and women, but I think boys are as vulnerable as girls because they do not have. And I think there is a lot of boy sexual abuse that we don't talk about because this is something that is like, again, when I say it's a patriarchal culture, so you're not allowed to, you know, you're a man, you're a boy, you cannot cry, or these are just small things that are just building up with a lot of big things. So imagine a boy being abused and unable to tell their parents, or never realize it's abuse, right? So never realize what's going on. So so this is something that is from Pakistani culture that I'm talking about. However, things are now changing, times have changed, people are more open to talk about it. And, when I started taking sessions back home with parents, school teachers, healthcare workers, so I knew like there was a lot of curiosity among them in asking questions, but it's just that, they never had that opportunity to, where to go, who to go, how to ask those questions. They just simply Google it. And I think Google is just full of myths and misconceptions. So whatever comes first, they just click that link and learn about things. And, there could be a lot of myths that even if they are teaching their kids, maybe it's just full of, maybe it's not right. And then, but I'm so glad, there have been so much progress in a lot of non-NGOs. And I think schools are also working on kind of giving sexual health education, if not comprehensive, but still things are progressing. So I'm glad about it. Yeah.
Yeah, no, and you were talking about only giving it to girls, and I talk about this in my classes too, that we place a lot of burden related to relationships and kind of puberty on women. And so I think you're right. The boys and the young boys in our society are kind of growing up in this, like, your health doesn't matter. Your emotions aren't, you don't need to have emotions. Those are for girls. And then we expect them to have healthy relationships, right? And so how can we expect them, right? We didn't give them the skills and the tools to be able to do that, but then they're burdened with it when they don't do it. And then it's all on the girls, right? And so I'm really sad to hear it. It's not surprising, but kind of sad that there is none. But I'm glad to hear that it's kind of progressing, and it seems like they're trying to work kind of around the current structures and what everybody is willing to do. When you were talking about religion, I kind of thought about it, and I think even here in the US, like, there is this, I think there's a lot of fear around including religion in sexuality, but I think that's so misunderstood. I think we all have values, and I think it's figuring out, based on our values, how can we teach people how to have healthy relationships in those systems?
Yeah.
Would you agree? Do you think what would you say are some of like the practices that might be taught? I know we didn't talk about this in our question, but just kind of something I thought of. And if there was like a Muslim-based, like healthy relationships and communication, or some sort of sexuality education program, what do you think some of the big components might be?
I think the big components would be respect. Respect of all kind of, like, and you just, like, homosexuality is something that is not encouraged at all in those religion. And there are a lot of people who can never come out and say, like, we are homosexual or we are bisexual or whatever, but it's just like, but I think there are just some basic things that everybody has a right. So if everybody has a right to education, so this is just a simple part of education. So when you are giving them any kind of education, sexual health is just their right to get that education. Other than that, if you are talking normally about physical health, or your physical health, your mental health, sexual health is as equal as your physical health and your mental health. And I would definitely say that, if you don't have a satisfactory sexual health, or if you don't have, so then that part definitely affects your mental health and your physical health. And so I think whatever religion is there, like, every religion would kind of give you same values of respect and having to have I know, it's just like, having to understand, just have that satisfactory thing within yourself, like, you are self-content, and you can be self-content by having all those things, like, your physical, your mental, your sexual health, like, everything is in place, and you have then that options to access care. So if you're restricting people from accessing care, or if you don't have anybody to answer your questions, then yeah.
No, I agree 100%. They're kind of some similar tenets across religion and sex education curricula in general, right? Respect, boundaries, consent, things of that nature. And you're right. I think when people don't have appropriate resources like a trusted adult or education, they go to the internet. And like you said, there's so much misinformation and so many people that maybe say that they are sexuality educators or health educators in general, but are not providing factual, scientific, culturally appropriate, all the other things. And so unfortunately, I think it does lead to some poor decisions based off of the information they had at the time.
That's right. Yeah.
So when you think about how sexuality education and even like your work, we'll get into it. How does that differ from your work in Canada? What have you noticed about like, what are the tenets of sexuality or sexuality education in Canada?
Okay, so I'll start from when I chose to come to Canada for my PhD programs. I think that was the biggest reason because again, when you just have when you are not in that place, you just have information from the internet. So I just learned Canada has the most they are most open and liberal about talking about comprehensive sexuality education, and then people have freedom and they respect. So knowing all those things, I decided to pursue my PhD and just come here to my PhD. So for my PhD, I actually wanted to learn about how if the adolescent girls do not have that access or to the sexuality education, so how it impacts their psychological well-being, because it's all connected, right? So when I came here, again, when you're doing your PhD, so sometimes you just come with big things, but again, you just have 4 years, 5 years to do your PhD, and then your focus is not as much as, I mean, you want to do a lot of things, but again, in that 4 or 5 years, you cannot do a lot of things.
Yes.
So when I came, I wanted to learn about how when so my when I came, so I wanted to know when they are getting sexuality education. I didn't think when they're not getting sexuality education. However, when I came, I realized sexuality is still a taboo topic, even if you're talking about Western cultures, right? So it's not there is much more freedom. People can talk about it openly, but then there are a lot of challenges. Even if you talk about Canada or US, the challenges are kind of different than what I faced in Pakistan. However, the challenges are still there. So for my PhD, I actually started to recruit adolescent girls who were first generation or second generation Pakistani girls. So either they were born in Canada, or their parents, or they were born in Pakistan and they immigrated to Canada. And that was a big eye opener for me. So I did qualitative interviews with an art-based approach. So again, talking about sexuality is again, very hard. It's not easy to talk about your personal experiences, how you grew up. So then we decided to bring art-based approach. So we had those timelines. So we asked those girls to develop a timeline of when you realize what sexuality is, when you started to learn those messages. And from that point, just tell us how your journey was. And then again, if you do qualitative research, so you're again, you cannot have so many participants. I only have 21 participants in my research, and I was so shocked to see out of those 21, 3 participants mentioned that they were being raped. Their parents were never aware about it. Out of those, one of them was she said she was in Pakistan when that happened, and then she came to Canada. There were 2 girls. She mentioned it happened in Canada, and it was a dating violence that we again don't talk about with teenagers. What dating violence is we are oh yeah, parents are they are grown up, they understand things, so now they have girlfriends and boyfriends, but we don't talk about violence. That's all part of it, right? And then sometimes people are stuck in those relationships. And then a lot of people, a lot of those girls, so their age ranges were from 14 to 19 years. And a lot of those girls mentioned that, when they were growing up in Canada, although their parents were Pakistani, right? So they never gave consent to them to attend those classes, the sex education classes. And that's again it's a very debating topic. Do you need consent for other education? Then why sexual education, right? So they were never consented for that. People were forging their parents' signature and then still go. Some didn't go, but managed to get information, secondhand information. So just try to understand, is first-hand information is good or secondhand information is good? And yeah, so that was something that was really um, bothering me. And then I asked, like, what are your recommendations, like, going forward? What are some of the things that you would like me to change? So they're like, go and talk to our parents. They need to understand those things, right? So again, in Canada, the sexuality, so going back to your question, like, in Canada, things are good, like things look good. But sexuality education, when it starts, in the school, there is no consensus in overall Canada. Like, all the provinces and territories have different sex education curriculum. And then again, when we talk about who is teaching that sex education curriculum, are those teachers are trained? So the answer is no, those teachers are not trained. Like, again, different provinces, they are trying to kind of bringing up trainings for teachers. However, there is no data on how that training is going, or um, you know, are they still confident in teaching that content or not? And again, when speaking about teachers, like, so again, they are coming from different kind of values, they have different cultures. So is there any data available saying that what kind of education those students are receiving? So yeah, that's the big concern right now. In terms of other things, like when we talk about sexual reproductive health, so other things also comes in, like contraceptions, abortions. Again, different rules in Canada. So, as you know, like, healthcare is free in Canada. However, contraception is not. So
Really?
yeah. So uh, British Columbia has just approved contraception as free. It is prescribed in March 2023. In Ontario, I know they are doing some things, like in terms of um, having contraception free for people who are under the age of 25. But what about other people? Like, when we talk about contraception, it's like we talk about the whole range of reproductive age, like goes
Right.
up to 25.
Right.
So,
Yeah.
and Alberta, it's not free. So I'm from Alberta, and it's out of pocket. And similarly for abortion, so abortion care is like usually good, like access to abortion is free here. Like, nobody would ask you question, or nobody would ask you for the parental consent to have abortion. However, there are inequalities in terms of, if you are living in urban areas, the access to abortion is good, but if you're living in remote and rural areas, the abortion access is not really good, or I would say post-abortion care. And again, if I know there are some provinces like Prince Edward Island, so if it's like 12 weeks onwards, then some of the amount is out of pocket. But the point is, like, when we talk about sex education in Canada, it's generally good. But again, there are not much evaluation in terms of um, why there are no consensus in terms of consent, in terms of access to care, in terms of inequalities. It's still there, and there is a lot of things that needs to be done, especially, I would say, for the racialized population. Like, as you must know, like, Canada is accepting a lot of immigrants, refugees, and there are people from racialized communities like LGBTQ plus. So what about their rights, right? Because they are already vulnerable, and all these things, like, related to sexual reproductive health or mental health, they are adding more burden. And then, if we see the general trend of suicides, it's just increasing. And why it's increasing? So is it just because of mental health, or is it just why the mental health is affected? So there are so many things. It could be lack of access to healthcare services, and that just adding burden on the mental health, and that, can eventually lead up to the such consequences, which is like nobody wants it, right? So yeah.
Yeah, no, and I think I remember that there are places that are doing better, but I think us sexual and reproductive health folk know that we're not where we need to be in terms of accessing healthcare. And like you said, if I didn't know, I'm not researching in Canada, but if I don't know that, it's not covered, a youth in high school is also not going to know that contraception isn't covered, right? And so we, like you said, we need these competent, trained, confident sex educators who are in these schools or in other kind of religious organizations or other places getting this information to our students. And, I think you brought up a really great point that we do need to train our health educators. And I think it's all about how we frame it. I keep coming back to, unfortunately, we can't say sex education, right? Because then they think we're teaching them how to have sex. And I don't know any curriculum that does that. Still yet to find one.
Yeah.
But we do need more evaluation and more research into like what makes a good sex educator. What do they need to feel prepared? How can they answer student questions? Are they culturally competent? What if they're, if their students in their classroom don't agree with their practices? Legality around answering certain questions. And so I think you're right. We need to train folks how to be more confident sex educators, and we need to do more research into how can we make them more confident. Because a lot of my students talk about having health teachers and really PE teachers that are teaching health, that don't necessarily want to be teaching about contraception and other things. They'd rather play, pickleball and badminton. I don't know, but that's a really great point. And I think it's really cool though to learn about what's happening in other places so that we can kind of see where we are baseline and how we can kind of come together as a nation and a world to level the playing field a little bit. So shifting a little bit, you come from a really unique background in that you're in the nursing kind of clinical space, and now you've kind of transitioned into this like academic part. But, why did you go? We talked a little bit about nursing and kind of how you had that experience with that one mentor. Was there any other, like you said, you didn't have any classes in sexual health or anything like that. So maybe start off with like, why did you choose nursing? And let's start there. Why nursing? Why that program? And would you have liked a class in sexual health?
Sorry, can you repeat your last question?
Yes. So why did you choose nursing in the beginning? And then would you have liked classes in sexual health, being that you were at the bedside for a little bit and that you were interested in it? Do you think that should be involved in every nursing program?
Yeah, I think definitely, as we are teaching different kind of subjects in nursing programs, so I think that was part of my community health course or something. But as you are learning all different kind of, you learn about maternal child health, you learn about advanced critical care and all those things. And I think that, and then you also get opportunity to go to the clinical and practice those things that you have learned in theory classes. However, I think there could be so many people who could have been interested in this subject if they have like formal course of learning about sexuality education or just a sexual health, because that is something, because again, nurses play a unique role in terms of if you go to the hospital setting, community settings, schools, nurses are everywhere, and then as growing up you encounter as the child is born in the hospital, you have nurses. When you go for vaccination, you have nurses. When you go to schools, you have school health nurse. So nurses, if you go to anywhere, your general regular checkups, nurses are there. And then again, are we when we are just going for a general wellness checkup, are we actually speaking with our patients about sexual health, or are nurses competent enough to answer questions if the patients are asking questions? So yeah. When I was practicing back home, and then I was working in medical surgical unit, and there were a lot of patients who had ileostomy, colostomy. Again, this is a pouch that is outside of your body that gathers your stool. And then, just think about the body image of somebody who is like newly married or in a relationship, or, just think about, they have so many questions about the sexual health, but nobody asked me questions at that time. But what if somebody would have asked me questions like when they can resume their sexual activity? Or I never had answer to those questions because I never learned those things. So then my interest was to start from very early age, so my interest was kind of more inclined towards start to give sexuality education to everybody, not only to healthcare professionals. It's just education that everybody should have. As you learn about other things, you should learn about sexual health. So I would definitely say that, in every nursing curriculum, if you are a healthcare worker, you should have access to such kind of a program. Even if your school cannot offer it, there could be an elective that you can take. So then, that can give you opportunity to learn about it, and maybe, that can just spark your interest, and then you try to. Because I know there were, when I was in my nursing program, there were a lot of people who are interested in, critical care, or medical surgical care, or pediatrics, or, any other things, but not sexual health. Yeah.
Yeah.
Mhm.
So interesting that we kind of talk about this. So I'm teaching a human sexuality class, and a lot of my students are pre-nursing, some pre-PA and OT and PT, but we kind of got starting. One of the projects we're going to work on is basically evaluating our students' competency and confidence talking about sexual health as pre-professional students. And so one of the things we're going to look at is, are we preparing them through our human sexuality class to be better providers? So maybe we can collaborate on that too. And you can kind of talk to us about what do you think are some of the skills? We talk about cultural competency and talking about gender and identity, and what to do if you don't agree with the student's, the person's belief, and, somebody has a stroke and they want to know when they can have sex again. So just kind of helping prepare them for like the questions that are random, but you get. And so I totally agree. And we'll have to collaborate when we start working on that.
Yeah.
So, I come from kind of this health education background. I don't diagnose, I don't treat, but we still kind of intersect. So talk to me about how you think health educators and public health, and you're a researcher too, and how can we kind of work together as two fields, nursing, clinical care, and health education, public health? Like, where do you think the intersection is? Do you think there is one? Do you think we're working towards the same goals? Do you think there's ways we can collaborate? And what are some examples of things you might collaborate on or work together with?
I think, taking your point, we're working towards the same goal in terms of knowing that, whoever we are dealing with, no matter if those are child, adolescents, adults, they should have, access to adequate and appropriate sexual health knowledge, sexual health information. And I think our goal is same, but however, not everybody will come to the sex educators, not everybody will go to nurses. I think we should collaborate in terms of thinking like, we are taking care of these people, uh, from same lens, although we are in different fields, but we should have, in terms of giving respected care, advice, referrals, access, just to make them confident and make them empowered to access sexual health. Okay, because again, we sex education is like too much, like sexuality education. Again, it's not just one thing that you define and that's it. Because so I think when people are going, in different, when they are going through different life cycle or life processes, or they interact with different people at different fields, everybody should, you know, give them same information rather than, just coming from different kind of a backgrounds. And I know there are a lot of political influences or cultural influences that would take long time. What I'm talking about is, like, it's not something that would happen overnight. And I know a lot of people are struggling to do this from so many years. But, as as our world is changing so fast, and I would speak about it, um, what parents or what sexuality educators right now are dealing with. And again, that my study was only in Canada, but I'm sure that's, like, just around the world, especially how much our world is changing rapidly, and every day we are having new challenges. So dealing with those challenges, we should have like more sex educators, or I would say we should have more people who advocate for sex education or sexuality education, and just kind of normalize this conversation, so then nobody has to deal with that dilemma to ask questions or not asking questions, or coming out of that stigma and taboo thing. Yeah.
And, I think one of the ways we could work together is, like, you all know the clinical side of things. So I don't know anything about the drugs really that we use to treat these diseases, right? I know a little bit, right? Penicillin and some other things, but that's where I think you guys could come in, right? Like, I think trying to advocate that we need sex educators that are counselors, we need sex educators that are health educators, that are nurses, that are MDs, that are pharmacists, because we all come together from these different lenses, and we're all trying to help youth and people in general have better lives and to live healthy relationships. So you are Dr. Neelam, and so talk to me about, you said you came to Canada to get your PhD. So tell me a little bit about why you wanted specifically to go to the University of Alberta, why that particular school. You studied nursing science, so talk to me maybe first about why the University of Alberta and why your particular program, and then we'll get more in depth.
Mhm. Again, when I was deciding on which university to go to, again, I had like 2, 3 universities in Canada in my mind again. And also just looking at my interest in terms of, who can be kind of better suited to mentor me throughout the process, because it's PhD is not just for 1 year. It's like, you are engaged with somebody for 5, 6 years. So you need a better mentor to take you through the whole process. And then I also wanted to, I didn't want to lose my interest. Like, I just wanted somebody who can just take me, um, hold my hand and just take me through the journey. So I think I found the best mentors, my supervisors at University of Alberta, and I think that's the #1 university in Canada right now, especially the nursing programs. I think that was a definitely perfect fit for me, in terms of giving me that environment where I can conduct this research. So that's why I chose University of Alberta in Canada.
Yeah, and I when people ask me about advice or the PhD, not that I'm an expert, but I always say it's more important about who you're working for and who you're working with than the degree,
Right.
because I had an awesome experience. I cannot say better things about my program and my mentor, but she went to bat for me a lot. All of my mentors did, and I unfortunately hear a lot of negative experiences about PhD mentees and mentors. And like you, it sounds like you had a really great experience, and so I think you're so right. Researching who the mentor is and what their personality is like and their mentorship style and how they give feedback and how lenient are they and what are they expecting you to know. Totally agree. So can you tell me a little bit more about your area of study? I know you talked a little bit about this, I think, but your area of study, how did you figure out your dissertation topic? And anything about the dissertation process that is, looking back, you think would be helpful for pre-Dr. Neelam to know?
So again, I just wanted to learn more about how, whatever was my experience back home in Pakistan. I just wanted to learn more in terms of what happens if you get sexuality education. Again, it was in my mind like this is something that is mandatory in Canada. You learn about sexuality education. It's like more free. However, things that I have learned when I came here, I did literature search. I was like, oh, okay. People are, this is something that is a problematic and that is a challenging issue here in Canada as well. Um, so, so when I came here, and honestly, that is something when I would tell you like what one of my mentor told me. So I wanted to learn experiences from young people, girls and boys, teachers, school teachers, and healthcare providers, like particularly nurses. So that was my interest. And one of my mentor told me, Neelam, you cannot have all the things in PhD. I mean, you cannot. I mean, this is something that is too big of doing PhD. So then you just have to focus on one thing. So then I realized I just need to narrow down my topic now. And I was like, what should I do? So then again, going through the searches, my finding was like, the girls are the vulnerable population, especially adolescent girls. But again, I'm not saying boys are not, but that was something that was coming up, and I was like, I should go forward and do my study right now for my PhD for that particular topic. And then again, you will have like more time once you complete your PhD to do and work with other population. And I think I would definitely talk about it, what I'm doing right now, or what is my bigger program of research. So I would just talk about it shortly. But yeah, that was something that was in my mind, and that's how I ended up doing this dissertation. And then again, I just wanted their first-hand experience, so that's why I just wanted to do the a qualitative study where I can just meet with them, do one-to-one interview, learn about their experience. And then it's just so different when you are sitting with them. You are just not kind of recording their experience, but then you are also looking at their facial expression. People were crying, and just that anxiety, and then just talking about those stuff. And I think that's how and that was another part that I thought that was very, very important to brought into my PhD, was to do the art-based approach. That was a new learning for me, totally, how to and then how to kind of combine art-based approach with the qualitative research, and just see like how it was easier for them to define their journey, looking at the timeline that they have developed by themselves, and kind of also given it's just giving them opportunity to reflect on their journey, like what happened. And they were so I never asked them question in terms of is it affecting their mental health, because that was kind of a hidden agenda for me for my PhD. So I was just looking at, so when they were developing the timeline, so they were kind of telling me how they were feeling at each point. So a lot of girls that I had interviewed, they were said we were sad, we were we were nervous, or so many, like all those feelings. And then coming towards end, especially those girls who are 18, 19 years, and they have moved out from their families. So now they have more opportunity to explore their bodies more and learn, in a free environment, because they are not in that boundary where their parents are, where they had that restrictions and all those stuff. And and then at the end of their journey, in the timeline, they were mentioning they are more relieved, happy, more freedom. So yeah.
No, that's some advice that I got too, is make your dissertation realistic, make it feasible. You're here you're demonstrating these certain skills. You have the rest of your career to demonstrate who you are as an expert. And it's a hard thing to learn, I think, because you do want to do so much. You seemed like you really knew what you wanted to do. Is that right? Or did you kind of develop it over the 5 years? Do you think you need to have your topic figured out day one PhD, or is it something you can kind of develop over time?
Honestly, I would not say it was a day one PhD, but it took me around 6-8 months, where I met with my supervisors every month, and then we kind of work on our topic, and then started to look for other people who are exploring the field, still be my committee members, and then just develop that competent team who can work to this topic. Because in my topic that I was working with adolescent population, then there were two main content areas like sexuality, and then mental health, and then art-based approach. So there were so many things, and I was looking all my findings through the intersectionality lens. So all these findings combined, I just wanted to have a competent team, and I would never tell anyone who is planning to do PhD, because it's not possible that you come up with the idea and it would just go right as is, because there are so many changes. And again, as experts, they give you some advice like what is doable, what is not doable. Right. So yeah, and then honestly, when I came, I wanted to do this study back home in Pakistan. Okay. But then I realized, if you are in Canada, there are other people immigrant population, they are still Pakistani, or South Asians, but they still have those needs. So so then, this is how my kind of topic changed in 6 to 8 months. And then, so again, it didn't take long time. I would say not 2 years, but I think I just sorted this out within 6 months, 8 months. Yeah.
I think there's a lot of reflection we do during our PhDs about where we want to go and what skills we want to learn, and kind of learning to go with the flow and challenges and resilience. And no, I agree. So kind of transitioning, you've had a lot of really cool jobs, and kind of going back to that advocacy and kind of sexual health awareness month. So, we don't have to go through all of them, but maybe think of one or two that you really, really enjoyed. And a lot of them have been in research. So talk to me about how you kind of found, maybe describe one job that you really loved, or besides the one that you're currently in, we'll talk about that next, but one that you really loved. How did you find it? And why did you decide to choose that one?
Again, my bedside, I would definitely go back to my bedside, my first ever like real job, where I worked as registered nurse, because I think once I realized like there are gaps in my knowledge in terms of sexual health. Maybe I didn't have that knowledge in giving that information to my patients when they were asking questions, because a lot of people were really young who were coming for surgeries and different kind of surgeries. But I tried my best to kind of advocate for them in terms of at least have to have that history portion completed for them in the initial assessment form, and kind of connecting them with their consultants when they were on rounds. And then, I just kind of encourage my patient to ask questions, whatever they can be. And maybe they might have like more knowledge than me in terms of talking about sexual health. And again, there is also a issue about, if there is a male patient, maybe, they are not asking that female nurse, and then they are not comfortable again, looking at the cultural things and all those stuff. So then kind of connecting them. So, I think that was the first thing that I would say that actually really helped me to progress into what I wanted to do or what my interest was. When I was completing my master's program, there was an opportunity to attend the training. So that was a Youth Champion Initiative program by Rise Up, and they are based in California. So they had a program on leadership development for sexual and reproductive health for young people. So they selected people from 4 countries: Pakistan, India, Ethiopia, and US, and I think some states from US. So that was a very competitive program. And I think there were 4 people from Pakistan. So I was one of them who got selected. And I went to US for it was 7 days long training. And that was that was amazing. That was great. So that connected me with all the jobs, like in terms of, working in different kind of NGOs. So when I was coming back from that program, so we were asked to submit a proposal, and the proposal was accepted, and it was not a big funding, but was $12,000 funding. So it was back in 2014. So I got that funding. I ran a big program, a cascade training approach for healthcare workers and school teachers. So it was a train the trainer program. So we trained them, we gave them 3 days training, and then we said you have to kind of replicate that program wherever, in whichever field you want. And then we will come and see that, and then we will give you certificate of master trainer. So that it's just if you are not there, there are other people who are trained on the subjects. So that was something that was really, really great opportunity for me to connect with different NGOs. So and then and then different opportunities came to me for I was algorithm consultant for 2 of the NGOs back home in Pakistan, and that algorithms were for the telehealth setup. So then if you receive a call and they have a questions, so in terms of contraceptions, so again, people who are again sitting in the telehealth setup, sometimes they do not have answer to all the questions. So they have algorithms. So whatever people are asking, so they just go through that algorithm and answer those questions. So then I really loved that job. And that was a short period contract for me, where I developed those algorithms where people still have access to phone, so they can just give a free call to the telehealth centers, and then they give you information about it. So I think that was something that I really found was interesting. And I think that also helped me to kind of develop my confidence in terms of becoming a sex educator, or just kind of giving that tools to people where they can also help other people. Yeah.
No, I think having those accessible online telehealth options, and especially anonymously, where people can ask questions oh, I can't feel my IUD strings, or there's a rash and I use spermicide, or whatever it is, and they can ask questions and have accurate information is so important. I don't think we maybe do a good enough job of kind of talking about all those avenues. That sounds like a fun kind of mythbuster job. When you think about your position now at the University of Alberta, it's recent. Congratulations. I know it's exciting, as any job in academia these days is coveted. So tell me a a little bit about your role, the research that you do, and why you specifically chose this position.
Mhm. I think this is perfect position for me in terms of in our position right now, I have like 40% teaching, 40% research, and 20% services. So then that gives me the opportunity to do all my work that I want to do. So I love teaching, so I'm still teaching. And then some protected time for research. I can do my research, and then services where I can provide services in different kind of committees where um, you know within my expertise or wherever my expertise is. In terms of research, I would specifically talk about my research area because I think this is my program of research, and that is my vision for like at least for next 5-6 years, where I want to see myself. So again, my bigger program of research is still to empower young children and adolescents to have comprehensive sexuality education. But again, this is something that it just sounds like, you know, a, a, a thing, but it involves a lot of people. So I am currently working with the parent populations. So I so anybody who is listening to this podcast and who's in academia understands, like, in order to do some kind of a work in academia, you have to apply for grants, and once you get funding, you can work on different kind of things. So I've just started my position, but I've already started working on different grants where I am not only focusing on children and adolescents, because that's the one part of the that big thing. So I'm also working with the healthcare professionals. I'm working with a group of parents, and I'm working with I would like to work with school teachers. So the recent grant that I have submitted, so for my postdoctoral fellowship, I actually work with a group of parents that was a parent advisory group, and I asked them what are their challenges or the barriers they face when they have to talk about sexuality education with their children. Based on that, again, the findings were so extensive. Again, as I said earlier, like they want to talk, but they do not know how to talk. What are the resources they should use? There are some authentic resources, but I was so surprised to see. And there are so many resources that are authentic, but they are not free. And like, I don't think so a lot of people would just go and buy sexual health resources to learn about that, to teach their children. So yeah. So my idea was to develop some knowledge translation tools for them. So like interactive infographics, and then that recommendation was coming out from my focus group discussion. Like parents want to have that small videos, and when I say videos, those small videos are just like TikTok or Reels.
Okay.
Because they do not have a lot of time, so they just want to learn. And in last 5 years, I would say, like over a decade, we are talking more about sexual orientation and gender identities. And now when their children are going to the schools, they are meeting all kind of people. So they want to learn how to speak on those topics.
Got it.
So then when the children go to schools, like they respect, and they just it doesn't, like, it should not come as a surprise for them. So they know, like, we talk about pronouns now, like, what is the pronouns, like they should know, but they don't know how to talk about it. So now we have decided to work on. So again, as I said, like the findings were so extensive. So one thing, this is just one part where we decided to develop uh, uh, a small video on gender identities and sexual orientation. And I'm working right now, I'm collaborating with, so in Alberta Health Services, there is a department called Healthy Children and Families. So they have resources for parents, but again, the resources are kind of, I would say, binary and outdated. So they really wanted to work on that. So now we are working on a prototype, and then our prototype is like ready. And this month, hopefully, we are taking this prototype to our parents group and asking them, like, is it understandable? Is it easy for you to give that message to your child? And then converting that prototype into a animated video, a small video of 1 minute or so. And I'm really excited about this because this is going to be big, because we do not have something like that. So yeah, these are the two things that I'm working on right now. Right now, the other project that I'm working on again came out from my study where parents were so concerned because I did my focus group discussion last year and this year. Um, after COVID and during COVID, everybody is online. Like everybody was online, even children, like they were having their education online. Parents were so much concerned about when they are doing like that multi-people chat.
Mm-hmm.
The chat there are inappropriate messages, pictures, asking questions, so many things, so many things.
Yeah.
So there comes the topic of online child sexual exploitation and abuse that's happening a lot. Again, in Canada, we just the report was released in 2021. Um, that report was from 2014 to 2020 that shows like there is a lot of online child exploitation going on. However, it increased 81% in 2021. Can you imagine like the effect of COVID-19, where children are on, and even when children are doing their education online, like, parents cannot be like, they cannot sit every time and they're, just
No.
learning it.
No.
So they're just saying, oh, we have to do our homework, we have to do this, we have to do that. Oh, go ahead. You have access to internet, you have access to computer, just go ahead and do it. So then I have submitted a grant and I'm hoping to get it because this is something that is going to be very important, where giving that tool to parents to understand what is online child sexual exploitation, because online child exploitation is not only pornography. It's a lot of other things where we talk about sexting, sextortion, sending inappropriate messages, so many things, people are asking to share pictures, and then it's a continuous cycle because those people can kind of haunt you for I don't know for how many years, because they have like evidence proof and it's everything that is online, it's there.
Yeah.
So they don't know how to speak about it. And like, so again, giving them those tools to teach about online child sexual exploitation. Again, they do not know, like, where they do not know, like, where to go if something happens. Um, so what to do, where to go, access to services, like, what are the avenues where they can go and seek help. So kind of working on that part. And the other thing that I'm working on for in a bigger area of research is to have a conversation, like, one-to-one interviews with early childhood educators who are teaching programs from 0 to 5 years of age, like the preschool,
Mm-hmm.
and how they're talking about sexuality and gender with the kids.
Mm-hmm.
Again, this is something that is it's not something that is like coming up as a very new topic. People are doing it. However, just need to, there are not many studies in Canada. It's just one that has been done in Ontario province only. And I said, like, there are no consensus in all the provinces. Everybody is doing their own thing. However, as far as I know, there are no such policies or, rules and regulations for early childhood educators, or there are no trainings that is available. So I just would like to speak with them, like, how they talk about it, what, if the questions comes up, like, how they deal with it. Because toilet training and all those things starts very early, and then toddler like ask all kind of those questions, right?
Yeah.
So how do they deal with it? Like, what are their attitudes? Like, what are their information needs? So then, and then try to do something for them in terms of changing curriculum for them.
Okay.
And then again, you have to give them tools to be empowered. You cannot invite sex educator everywhere to teach. So that's why everybody, parents should have some tools, like those healthcare workers should have tools, like where they feel confident and they feel, um, you know, uh, to talk about those kind of things if the questions come up. So that is something that is my plan for next 5 years, and I'm really excited about it. So yeah.
Oh my gosh, you're involved in so many cool things. And I think we do often think about sexual decision making as such an kind of personal and like behavioral thing, but it really is the systems around us and the people that are like you said, parents and teachers and healthcare workers and friends. And so I love that you're kind of going at it from this kind of community aspect and the interpersonal aspect, and not so much of kind of that interpersonal, like we think about in the SEM. There's another, I was thinking as you were talking, there's another curricula that I'm trained in called Teen Speak, which is not necessarily sexual health based, but it is parent-teen communication. So I linked it here, and I'll link it for our audience members, but it's kind of a way of reframing how to talk about difficult and challenging situations. And so this might be something that might help you in developing yours. But very interesting for parents because it put a lot of the autonomy on the child and took away a lot of the power from the parents. And I think that can be really difficult. I'm not a parent, so I don't know, but I imagine as a parent, kind of giving up the authority and allowing the child to kind of have some decision making can be difficult. But yeah, I am so excited for all your work. You'll have to share some results with us and things that happen. And I have no idea if my parents would have gone to things like this, but I think if parents knew about them, especially like short clips and things like that. I love that you're kind of doing it through some different mediums. So you have your own podcast called Transcending Gender, correct?
So that's not my podcast, but I'm part of the podcast called Repro Health Transcending Gender. Okay. Yeah, so I spoke about conservative cultures and sexuality in that podcast.
Gotcha. Okay, so maybe you can share that with us and help our learners. Well, you told us so much cool stuff. I think we could talk about things we could collaborate on for a long time. Just some kind of closing questions as we think about it. This org was really created to kind of help connect young professionals, my age, younger than me, and kind of first five years of their career. So, how do you think this org can help bring people into the space of kind of advocating for sexual health? And what do you like about the org, or what do you hope to see in the future?
Mm-hmm. I think that's I think it's a great idea because a lot of people are now, it's not just different organizations, but people are very much interested in advocating for themselves. So you will see like young people, especially, LGBTQ people, all those people are just coming up and speaking about it. It's just we are a push for them. So then we should continue working on sexual health, and we should just kind of give them push to. So again, as you said, taking some power away from parents or elders. Yeah. So now we have to empower like those generations. Like it's just a totally different kind of a generation, and then you cannot rule them. So you just have to give them tools to, so they can take decisions as they grow up. And I think it's again very, very important. Like, if you don't start this early, then you can have like so many consequences that are not in favor of them in terms of their overall well-being. So if you want a healthy population for your country, and I think especially in Canada, when with a lot of immigrants, we have so many young people here, so many young people in Canada. And, all these young people is like, it's your country's future. So if you're not investing in them, like, just give them that push and then those tools so that they can take decisions for themselves. Yeah.
No, you're right. These kids, they're real smart. They adapt quickly. They are witty. And I think one of the things I keep thinking about is the generation below me is they're advocates. They are passionate about all different things, and they will stop for nothing. And maybe last couple of questions here. When you think about sexual health, reproductive health, your world in the nursing field and kind of disease prevention, like what do you think is one thing that's misunderstood about our field, and one thing you'd kind of like to myth bust?
I think one thing that is, I would say, is most misunderstood, and you would read lots and lots of articles on that, is that when we start talking about sexual health, especially for children, young people, adolescents, there is a lot of pushback from parents' community. And what is this pushback about? Because they think that we are taking away their innocence. is, I would say, is a big myth, because you are not taking away their innocence. And I think very, very early in the podcast, we talked about it, like, when as adult or as grown up, when we talk about sexuality or sexual health, it's all some kind of a taboo, but it's not. Like, sexuality is just a normal and normative process. So instead of thinking like, you are taking away their innocence, like, think about, they are the victims of child sexual abuse. Are they now, now their innocence is gone.
Yeah.
Now their life is like, they have so many challenges throughout their lifetime, although they seek treatment and, all those things. But, so it's better to kind of give them information, because you're not. So that's, I would say, that's the big myth that I think is there for the sexual health, that you are taking away their innocence, but that's not true. Yeah. Yeah.
Yeah. And as soon as you said that, I thought, like, we're trying to prevent them from having negative experiences as young people, right? We're trying to give them definitions of consent and boundaries and what unhealthy relationships look like. So if they experience it, they can stop it and they can help their friends. And I think, like you said, there's this false notion that they're not going to engage in these behaviors simply because we don't talk about it. Their innocence is being taken regardless of whether we talk about it or not, right? So no, 100%. I love that. Little more personal, tell us something that the listeners couldn't find about you or know about you from your social media platforms, from your awesome research. What's something unique about Dr. Neelam?
I think that's a difficult question. Anybody who is, my friends, like, where I work with, they know like how passionate I am about sexual health. And one thing that I would say, like, when I was working back home about those topics, like, and again, as I said, like, I was from the conservative, like, traditional culture, coming from that side. So when I was, and then I was also living in the very close-knit community and talking with people, I had always that thing that where people could go to my parents and say that, what is your daughter talking about? Because I was not married, and like, and then there is an assumption, like, how you can talk about sexual health when you're not married. Again, that's back home thing. But
Right.
I think nothing that could have stopped me doing what I wanted to do. So my passion is there, and that's not unique. But I would say, I think I still would like to work more on it, and I'm very happy that people are more accepting of these kind of subjects, and not only in Canada but back home in Pakistan also. Uh, so yeah, if anybody would like to follow me, I have like my social media handles like Facebook, Twitter, LinkedIn, so they can definitely go and see my work. But yeah, it's just great reflecting on my journey with you. Yeah.
Yeah, no, like you said, I think there's definitely some pauses that we have as what we do. And I think there's again, just a myth about what our purpose is and why we do this work, and this assumption that we are engaging in these activities that we're telling our students about, and that we're hypersexually active and all these things that are
Yes.
just
Oh yeah.
not true in any capacity, right? And I think you're right. There's so many times when we could stop doing what we're doing, but we know that what we're doing is good, and that we're trying to help young people have better healthy relationships and prevent violence and teach them about puberty and menstruation and contraception. And if we stopped, I think that would be a disservice to ourselves and the young people and adults that we serve, parents that we serve, and we have to stick together.
And sometimes you see those negative comments in your blog post on all those things that would kind of tell you like, but I think nothing should stop you if you're passionate about something. And even like anybody who would like to join this field, just know that there is much, much more in sexual health and reproductive health. And as our world is changing with COVID-19 and all those things, there are a lot of new challenges that are coming up, like technology facilitated gender-based sexual violences. And then there is a lot of work that needs to be done. And I think as much work as, a lot of work has already been done, but it's just like, every day there is a new challenge. There are new challenges. So I would definitely, anybody who's listening to this and they are passionate about sexual reproductive health, just, I would say just come into this field, and, there is a lot of work that still needs to be done. Yeah. Yeah.
1,000%. We can use all the soldiers we can get. No, and I think you're right. If we stopped every time somebody told us not to do it, it would be sad. But I think you're right. Sometimes I've been told, like, if you're not pressing buttons and you're not if it's not being challenged, you're probably not doing it right. I just love your tenacity and your courageousness and your kind of passion. You can tell it shines through what you talked about. And yes, we would love for people to follow you. We're going to link your LinkedIn and your Instagram and your Twitter all to our social media pages so folks can get in contact with you. And anything else you'd like to say before we kind of close out here?
No, I think it was great chatting with you, Megan, and just talking about the whole journey, how and where I was and how I started, and how I think it's been, I would say, 13, 14 years, and I see a lot of, so the change is there, but again, it's not overnight. We still have so much work to do, but I think I just feel great chatting with you and knowing that, I have come so far. And yeah, I'm so excited to collaborate with you in future, because I think that is something that I'm looking forward to, doing networking with the, different folks, not only in Canada, but in US. So yeah, it's great.
Awesome. Thanks so much.